Exactly, and obesity puts a tremendous strain on a person's body, and the developing chronic diseases puts a tremendous burden on a person's body, on a person's life, on the person's family's life, and the system itself in terms of cost. And so it is all interconnected, and it relates to everybody. Now, the issue with schools is that one of the things this initiative is trying to do or has proposed, and again, this is another policy piece that needs to be passed, is that kids have their BMI, their body mass index, measured every 3 years, and that be reported back to parents in a confidential way.
Now, is that at school? Is that at a health center? Who does that for them?
The school. So the school nurse. So by law in Massachusetts, children in schools have to have their weight and height measured. Some schools are already calculating BMI and reporting it back to parents. Other schools aren't doing anything with that information. So what we're saying,
they keep it to themselves and they don't give it to the parents?
It's on file.
So is it just a statistic sitting in a drawer?
Yeah, basically.
Or in a computer?
Basically, somewhere on a file. That's where it is. So what we're saying is, why don't we bring some uniformity across the school system where kids every few years, every 3-4 years, have their BMI measured, calculated. That information is reported back to parents. And as you said, many parents, many people don't have enough education around nutrition, around physical activity, and don't know or may know, it's not to underestimate parents and what they know and what they should do with their kids or not, but many don't have that information. So what we're saying is, here is a note about where your kid is at. If you would like more information to learn about what to do to better the health of your child or yourself, or your whole family for that matter, here are some resources, and the Department of Health is putting out some resources, mainly in this case, in the form of the website, which has, as I said, tons of resources, but also to the point that we're giving people healthy recipe ideas, what to do at home, what to do at work, what to do in your community.
And something that's easy, because in this fast-paced lifestyle that we're all living in, you want to have something that's quick, that's easy, that's affordable, so that, there really isn't an excuse. To kind of go by that fast food place and pick something up. You have something there that's nutritious, that's healthy, and that tastes good. It can taste good. It doesn't have to be something that, I don't want to eat that.
Absolutely. And sometimes you just need ideas. Sometimes you used to do something. You used to pack a little snack to bring with you to work, something healthier, a piece of fruit, a yogurt, carrot sticks, some vegetables, and you forget that there are things that are perhaps not as boring as that if you think that's boring. And so if you go to this website, you find some information, people are sharing ideas, sharing recipes, you may say, well, it's not that bad after all. I don't have to buy a candy bar or a can of soda. I can do this at home, and it can be less expensive than buying a can of soda and a candy bar twice a day, for example.
That's right. Well, we just have a few moments left, but what I wondered is, what about public service announcements, or are you coordinating above and beyond the website to, how do we get this information out? I think if people realize the statistics, how staggering they are, and just what happens, when people are obese, and what it means to their life, and it shortens their life, and it's debilitating, and if you're brought up eating certain things, and then you have a child, and you're teaching the child those same bad habits, you're perpetuating something, and it is very scary, and especially where, unfortunately, many people are not as active as they used to be. There are all these distractions, and, computers are great things, but, if you're sitting at a computer, you're sitting, and you're not, you're not out riding a bike and doing a computer. You're sitting, and you're not burning any calories, and you're not out necessarily getting any fresh air. You're just sitting there and doing that. And unfortunately, these are a lot of the choices that people of all ages are making. So we need to be able to really get that information out there. So and anything else you can point to, or maybe things that we can ask the state and the legislature to do to help us with this?
Well, the Mass in Motion campaign itself, it does have some transit ads that are posted on buses in certain communities here in Boston, in the Lowell area. But mainly what this campaign is doing is directing people to the website. So that the transit ads, for example, say massinmotion.gov, something like that.
Say, what is that? And this is the way you get your
healthy recipes. Go visit our website. Also, we are doing spots on television. We have this website in Spanish. We're doing podcasts, audio recordings that are going on the radio in Spanish and Portuguese. We're sending folks to our website. Again, the website is the central piece where people can go for information. That's what we're telling everybody, not only residents, but also practitioners of public health, that they can go to the website and find information for their patients. So basically, really, it's www.mass.gov/massinmotion. That's where everybody should go for their information.
We've really made it easy. You've done the research. You have all these helpful hints, all these snacks or things that people can do to take off that weight or make better decisions. And all those things are so important. And so whether you're riding the T and you look up and you see that advertisement on it, whether it's, and I think it's wonderful that you have it in a number of different languages, particularly given where you mentioned the Latino population. It's a real challenge for them, and they need to have this information. And so making sure that they're having that in Spanish is so helpful, and I'm sure also a lot of the Latino stations are happy to work with you on that as well. So we just really appreciate, Jordan, everything that you're doing at the Mass Department of Public Health, Governor Patrick is doing, and President Obama and Michelle with her new garden, kind of bringing people's awareness of healthy choices and getting out there, rolling up your sleeves. It is springtime. It is the time we can really be out there planting, and maybe within a few weeks they may have some nice healthy choices that they grow themselves and take a lot of pride in, give them that extra reason. Nothing tastes better than that tomato that you grew yourself, right?
Right.
Well, that is wonderful. Well, I appreciate so much that you are joining us today, and Mass in Motion. It's a great website. We hope all our viewers log on and see it. And Jordan Coriza, I hope I'm pronouncing that correctly.
Right.
We want to thank you again for being with us and look forward to having you back real soon.
Thank you so much, Maura.
Thank you.
It's a pleasure.
Well, ladies and gentlemen, it is hard to believe the statistics that Jordan spoke of, but each and every one of us, I know, we get to make those choices each and every day, so we probably want to think about it, because what you do put in your mouth makes a big difference of how you feel and how healthy you are. So each of us can take a lesson from that, and we want to thank Jordan for being here and telling us about his website, and we hope many of you log on and learn a few tips. In a moment, we will be back, and we're going to be talking about Dana Farber and a number of initiatives that they have been doing and working on, helping so many people all across the Commonwealth. We'll be right back.